Good afternoon, Prof. Saku, friends, ladies and gentlemen. Thanks, John, for the kind introduction. I'm here to share with you our experience with the Written Asthma Action Plan, or I call it WAP for short. In the beginning, we started using it about 4 years ago, and initially we do struggle with it, and now it is part and parcel of our routine practice in managing our asthma patients. So what is WAP? Okay, so to certain of the audience here, maybe it's something new, but actually it is a concept that I believe many of our family physicians has been using. I understand from my GP classmates that actually they do counsel the patients, advising them to adjust the medication, but most of the time it is done verbally. So what we are advocating now is a written format of what you have been giving your patients the advice to adjust the medication. So what is WAP? It is basically an individualized self-management plan for your asthma patients. So it is a written format, and it is done in a step-by-step way to guide your patients so that they can recognize the symptoms of asthma, especially impending symptoms, and to adjust the medications accordingly and promptly before they actually experience the acute exacerbation. So it is a symptom-based, okay, in the past, in certain countries, they rely on peak flow monitoring, but you know your patients, most of them actually do not own the peak flow. So it is difficult to monitor the asthma, but we can use symptoms, okay? So it is a symptom-based asthma action plan, and for the Singapore National Asthma Program, we actually advocate the use of traffic light model in giving out the WAP. So the traffic light means that it grades patients according to their asthma symptom severity into green, yellow, and red, just exactly like your traffic light colors. If your patients have the peak flow, can always supplement the symptoms with the peak flow monitoring. So what does the traffic light colors stand for? Okay, we'll elaborate on this later. So why are we advocating the use of written asthma action plan? Why is it useful to the patients? Okay, it allows the patients to monitor their symptoms and to act promptly and accordingly so that they can avoid any serious asthma exacerbation. It is especially useful for patients with persistent asthma, and actually any asthma, especially for patients with a history of severe attacks. What is the evidence that it is useful? Okay, based on a Cochrane systematic review, if your patients are counseled and educated with the written asthma action plan, there's reduction in the hospital admission of over 38, the RR is 0.62, that means they cut admission by 38%. They also reduce unscheduled visits to the doctor, as well as reduce days of off work. And the best results are achieved when you provide them with a written form of the asthma action plan. And why is WAP useful for our family physicians? Ask yourself, do you prefer to manage your patients during an acute attack, or do you prefer to see them well sitting in front of your consultation room? So there is actually greater satisfaction for you if your asthma patients are well controlled and are functional. And this is what we're aiming for, okay? Symptom-free, well-controlled asthma. And of course, when they're well-controlled, they actually show greater appreciation of your care. You're a good family doctor to them. So I think it's very important that we try to equip every patient with a written asthma action plan. So what can written asthma action plan achieve? Okay, it prevents delay in the initiation of asthma medications, impending attack. Reduce a prolonged asthma exacerbation. Once you adjust the medication, we expect the symptoms to at least get better. Reduce side effects on patients' life, and they reduce excessive use of acute healthcare resources. Just to share some experience with you, we had a patient recently. I believe you have read the newspaper, the Jakarta floods. I have one asthma patient who was caught in the floods on his way to the Jakarta airport. He was stranded in a taxi for 10 hours. He developed an asthma attack. Fortunately, he had a plan with him and was able to adjust the medication accordingly, managed to survive the flight back to Singapore and come to see me the next morning. So this is just one good example. I have another patient. Again, somehow it happens to be in Indonesia again. This time he was in Padang, another patient in Padang, working in Padang, and again having an attack, and that was during the earthquake. So he had problem getting a flight back to Singapore. Tiger Airways don't fly every day. So he managed to actually use the plan and treat himself and able to come back to Singapore for further review of his medical condition. So these are benefits that the patient can have if they are equipped with the plan. So who will prescribe written asthma action plan? Of course, our specialists in hospitals. What we are advocating is every one of you here should be able to prescribe WAP to your patients, and we have also nurses trained to give out the WAP. So what does the traffic light means? Okay, red, everybody knows, stand for danger. Okay, it's time for you to stop. It's good that you just lucky you can get a ticket, otherwise it could be your life can be in danger. So you must stop, you must seek help immediately. Yellow means please prepare to stop, take precaution, okay, and you need to begin the management steps as what Prof. T.K. Lim has mentioned earlier. And of course, green means you're given a green light to do whatever you like, work, play, go to school. So this is what we want, everybody to go green. You can see my slides, the background is also green. Okay, this is, I think I've shown you, this is the WAP. I think Prof. Che has also presented this. It's available in the MOH website. Please feel free to go to the website. You can download the WAP. And I believe our MOH colleagues has also printed the copies for you to as a reference, because the words are tiny, so a copy in front of you will be helpful, so that you don't strain your eyes. Okay, what does the three colors, here we have four colors. Okay, in certain countries, instead of yellow, they have orange. So we have put them into the color bands, and on the left side, it states clearly the symptoms that the patients should be looking out for. It is for them to recognize the asthma symptoms. And how do they recognize the symptoms that the asthma is getting worse? Okay, they will have increased frequency or severity of symptoms, especially waking up at night. This is a very sensitive indicator of deteriorating asthma control. If they find that they need to use frequently the reliever, frequently the Ventolin inhalers, that's a bad sign. And even if you use the Ventolin, it fails to relieve you completely, that is even more ominous. And if the peak flow is decreasing, assuming that they have a peak flow meter at home, then they should take precaution. And all these are indicated in the WAP. Okay, so we refer back to the WAP. Okay, on the top part of the WAP, okay, is the green zone. So on the left side, you have the symptoms, and on the right side is what you will advocate the patient to do when they are actually well. Of course, there are patients with intermittent asthma. Okay, you can leave it blank. But for those with persistent asthma, then you need to encourage them to continue their medications. So the green zone, there's a list of the control and preventer medications. The maintenance dosage should be clearly stated, and they'll encourage them to use the preventer medications daily. So examples will be the inhaled corticosteroids, or the combination medications, or the Montelukast. Okay, if the patients are very well, only with episodic exacerbation, then this you can leave it blank. And we also have provision for the use of the reliever medication prior to exercise, if you think your patient has exercise-induced asthma. How do you counsel your patient? No, we try to use an analogy to convince them and to educate them. So normally what we would say is that, oh, this zone indicates that you're well without any cough, wheeze, or breathlessness. Just like the traffic light, the green, and you move smoothly with when it turns green. And in order to maintain a smooth journey, you need to continue to use the controller medication, and that depends on what you prescribe for your patient. We go on to the yellow zone. This is the more important zone. Okay, this zone educates the patient to recognize the symptoms suggestive of an impending attack and the need to adjust or step up the medications, okay, beyond their maintenance dose. So this is the most important step. How do you tell your patients? When you have cough, wheeze, or breathlessness, it is time for you to take precautions and slow down, just like when you face the yellow light at the traffic junction. It is time for you to take out this warp and look at how you will adjust your medications. Okay, the yellow zone suggests what a patient should do when asthma exacerbation strikes. Okay, you need to start using the reliever medication. You may want to adjust the preventer medications as indicated. And it will indicate when and how to use a short course of oral steroid for adult asthmatic patients. If symptomatic, despite an increased dose of inhaled preventer medication, fail to control the symptoms. So the steroid is still second line. You just need to use a reliever medication plus minus the adjustment of your controller medication. Very often I have patients that, they do remember to use the blue inhaler, the Ventolin, but they forget to continue to use the preventers. So it is very important to stress to the patient that if you are a persistent asthmatic, you need to continue the use of the controller medication even when you start using the reliever medication. And the doses can be stepped up to the maximum dose permissible. That depends on which brand of controller medication you are using. And you can use it for as long as up to 2 to 4 weeks. In the European context, they use up to 6 weeks. The inhaled dose may be doubled to 4 times increment, depending on the specification of the controller medication. For the adult asthmatics, you may prescribe a standby dose of oral steroids to be used by the patient 5 to 7 days if all the medications